As Wendy Patrick, Laura Fink, they join us with more. Ladies, good morning to both of you.
Good morning, Shelley.
All right, Laura, will this pass in the Senate?
Well, that remains to be seen, and it's very questionable. If it does pass, it will be significantly different. But I think it's important to also talk about what's in this bill, because it has a 17% approval rating. As Al Franken says, more people believe that they personally have seen a ghost than believe in this health care plan. and there's a reason for that. This version of it, the latest version, removes the requirement that they charge the same for people with pre-existing conditions. So what is a pre-existing condition, you ask? Well, I think about my friend Miranda, who's 6.5 years old and who's a survivor of childhood cancer. And Miranda will forever be tagged with this pre-existing condition mark, meaning that her premiums will skyrocket. Not a victim of childhood cancer and still concerned? Well, if you have asthma, heart disease, PTSD, breast cancer, migraines, if you've ever suffered a miscarriage, if you've been raped or a victim of domestic violence, all of these are pre-existing conditions, and all of them could cause your premiums to skyrocket under Trump care. That is why it is tremendously unpopular and why the Senate will take another look at it and determine if that is what they want to take home to their constituents.
All right, Wendy, what do you think?
Hey, it's Feel Good Friday. I don't feel this is the way we should be starting Feel Good Friday. However,
talk to Paul Ryan.
If you feel good, your premiums will go down. That has been one of the criticisms of this bill, that it's really got to be something that benefits everybody, not just those that are healthy and not just those that are young. In fact, we all remember Jimmy Fallon's very emotional testimony earlier this week about his son and the heart condition. One of the things that really has characterized the passage of this bill, I mean, Trump is celebrating after the first inning. There are so many hurdles to go through before this ever becomes law. And when it does, if and when it actually does get to his desk, it's likely to look very different. There are lots of aspects of this bill that Republicans and Democrats agree on. However, remember, it passed in the House with not a single Democratic vote, and in fact with a lot of Republican votes. So we are well away from the day that it's actually going to be through the Senate. But one of the things that is really being raised right now is exactly that, pre-existing conditions. Everybody has some sort of pre-existing condition is the worry, so we want to make sure it's fair for all.
Wendy, what exactly do you think needs to change in order for this to pass, besides the pre-existing conditions that you're mentioning?
Well, you know, as we've been talking about earlier, it benefits the healthy and the wealthy, right? That Laura and I were talking about this earlier. There's also going to be a concern for people that are in the middle of the pay spectrum. In other words, does it benefit them? Do their premiums go down? Premiums seem to be going up for everyone. But it's really got to be something that applies to more of the general public. That's at least the consensus in terms of those that are opposed to this bill. Republican lawmakers are very receptive to some of those claims and complaints, so no doubt, hopefully behind the scenes, they'll continue to work to make it better for all of us.
And when Jimmy Kimmel made that statement about his baby, people were attacking him because he made a political statement about health care as well. Talk to me about the CBO, this Congressional Budget Office, when they did their analysis the last time that we did this, and they said 24 million people in 10 years won't have health insurance that currently have it under Obamacare. The question now is, how did the House pass this version of the bill without first waiting for the CBO's report?
In the dark of night, that's how they passed it. Right now, they did not want traction to move against this bill. They learned the lessons of when the Democrats passed Obamacare and went away for the recess for 4 weeks and let the conversation continue to happen.
So it's not necessary to have that analysis from the CBO.
It's not a requirement, but it's good governance too, because you want to know how it affects. Now, with the removal of pre-existing conditions, that means the number of people that are going to be uninsured is anticipated to go beyond 24 million. And in addition, you know, when we talked about that savings that the wealthy that Wendy is talking about are going to get, you know, that savings is $3 billion according to the last CBO budget estimate, and that savings comes from people dying early. People literally are going to die earlier than if they were covered under Obamacare, and that savings is going to be redistributed for tax credits to the wealthy. Think about that for a minute. It really is astounding, the lack of focus on increasing the level of health of Americans generally, and instead benefiting a really narrow few.
Okay, Wendy, I want you to have the last word on this, and in terms of the CBO again, don't the Republicans in the House have a greater risk of maybe falling flat on their face again if this fails in the Senate because they didn't wait for these numbers?
That's always a risk, and you would think that they would have learned, I mean, on both sides, to wait to read exactly what is in the bill and learn all of the surrounding information necessary to make an intelligent decision. That is the problem. Nobody wants to be caught saying, well, I didn't know, I didn't read it, I didn't wait for the CBO.
Right.
Those are always risks. But you know, one of the things that we talked about with respect to President Trump's 100 days, everybody criticized him for not passing any major legislation. One wonders whether this was an effort to pass something, but when you look at what's being done, it's really a matter of it shouldn't be a matter of quality over quantity or vice versa. It's got to be something that's well reasoned and well researched before it gets passed.
All right, we could talk about this for hours, couldn't we? Wendy, Patrick, Laura, Fink, we thank you both as always for your opinions. Have a wonderful weekend.
Thanks
Thanks,
Raul.
Raul.
Thanks, Shelley.
We can enjoy perhaps